if the COVID deaths are precipitously falling in several countries, regardless of the percentage of the population vaccinated, why are we saying that the fall is due to vaccination? So this was again in February 2022. And this was considered to be misinformation. I thought that that was a pretty good scientific question. That really is the question. If a country is not been heavily vaccinated and they are seeming to be doing well, that should be a question scientifically that you would say, well, how is it that they're doing well? Is there anything that we need to understand in order to try and understand to get a better grasp of how to manage the pandemic? Why would they consider that misinformation?
Yes, again, if you look up lies, types of lies, there are 7 types of lies. People can Google it right now if they're listening in. I think it says 7 types of lies will come up. And one of the types of lies is called a change of definition. So as you know, during the pandemic, there were lots of changes of definition: death, injections, the benefits. There are a lot of change of definitions, including what a pandemic was in the first place. I think JAMA, based on what you're asserting here, Dr. Phillip, has clearly redefined what misinformation is. It is clearly defined in that paper that misinformation is information that goes against what is the existing narrative, against or any type of information that's going to make the leaders of the past look like they are incompetent, look like they were misinformed, and look like they misled. And so that to me is what JAMA is doing in this paper. They have redefined misinformation and basically said you better get along, you better go along to get along. Otherwise, we're going to call you a misinformer and censor you.
Mm. And I'm going to show you another one here that they mentioned. And I think this one here, I think that I would probably agree with them here. They said triple vaxxed are dying more than any other groups. This was on Instagram, and this was in March 2022. Um, I don't know where they got the information from. And to be frank with you, I think that when I looked at certainly the UK data, that probably wasn't the accurate. I think the people who only got one vaccine were the highest risk, then two, and then three. And so this was probably not necessarily accurate. But the truth
I,
is that I question why people have to try and find these numbers. I would have expected that this kind of information should be out there, very clear to see how deaths were matching up based on vaccination status. That's science, and that's being objective and truthful.
Listen, the information that allows people to be educated and properly informed was incomplete. I'll give you another example. One of the greatest accomplishments during COVID for me as an individual was we beat the OSHA mandate that was going to require all businesses with 100 or more employees to be vaccinated. We beat them in the United States Supreme Court. I wrote a declaration for that case. And here's what blows me away, Phil. Are you ready? In the
Yeah.
490 pages of that document where OSHA tried to make its case, do you know how many times it mentioned the vaccine adverse event reporting system? And keep in mind that VAERS is run by FDA and CDC. These are 2 public health agencies within the Department of Health and Human Services. In the 490 pages they used to try to justify mandating this injection, VAERS was not mentioned one single time. Which means, in my opinion, again, it is important for us to go to the general public and say, you cannot believe everything you read. You cannot believe everything that comes across social media. You have to ask for references. You have to actually be a critical thinker of the information you're receiving. You have to ask questions from people that you trust. But censorship is certainly not the ideal way of keeping a general public engaged and informed during an emergency situation.